everyone, welcome back to our ABN booth at the KT Canada meeting here in Vancouver. We are so pleased to have Jennifer Baumbusch here with us today. Thank you for joining us.
Thank you so much for inviting me.
Of course. Would you mind telling us a bit about yourself and how you're involved in knowledge translation?
Sure. I'm an associate professor of nursing at UBC, and my background is in long-term care, and that's where I've worked for about the last 20 years. And so my journey into knowledge translation is a little bit funny because I have always done a lot of community-based research, and so didn't necessarily call it knowledge translation research.
It was just what you did.
It's just what we do.
Yeah.
And there's a lot of nursing just like what we do. So, so I think I was beginning my research career around the time that knowledge translation was starting to be the language used by research funding bodies and other researchers. So that's really how it came about. But I didn't necessarily think of it in these formal terms of knowledge translation.
Yeah, because it was just sort of a core part of what you were doing and what you thought was important. Of course. So tomorrow you will be presenting some research that you are involved with.
Yes.
Would you mind giving us some highlights of that presentation and the research you're doing?
So my whole research program is really focused around improving the inclusion of families in long-term care settings.
Okay.
So you can't really do that without having them be integral to your research.
Of course.
So for the past several years, I've been doing ethnographic research in long-term care settings, which is where as researchers we go there, we hang out, and we interview people and we do observations. And what we're really looking at was how people negotiate their roles in this institutional setting. So the family members, the staff, and the residents. And part of what came out of that research were families asking for opportunities to meet each other more, to learn about particular aspects of long-term care that they weren't familiar with.
Just to clarify, by meeting each other, do you mean meeting with the staff members or other families?
So meeting with other families. Because it is interesting because if you look at, so sometimes the policies of a place around privacy and confidentiality can cause we call them visitors. I don't like to call family members who go into care facilities visitors because they are so integral to that space. But sometimes there aren't places for them to meet each other. So that's what they are looking for, and that particular facility didn't have a family council. And so we decided to work with some of the families at that site to develop a workshop series which would provide education and information. So tomorrow I'm really talking about this experience of creating the workshop series. And what we did was the actual team that developed the workshops included family members, research trainees, and researchers. So we all sat together and talked about what would these workshops look like. And that's what I'll be talking about, how that process unfolded.
Yeah, that's very interesting. And actually, it makes sense now that you mention it, that families would want to be involved with each other, because in our communities, in our neighborhoods, you want to speak to your neighbor, you develop that relationship, so why should it be any different in a long-term care facility? Yeah,
and I think sometimes, in institutional settings like long-term care and also hospitals, there's sort of this artificial separation of people. And so we have family members who say, I see that lady who comes every week, and she comes at the same time as me, but we've never talked.
Yeah.
And they want to have that connection. And so this study that we built out of the original study was really about how do we, as researchers, help to facilitate those connections among family members.
Yeah, it's really interesting. And so for the residents who are living in these long-term care facilities, how are they impacted by family involvement at a workshop like this?
Yeah, I think that's a great question. So for the residents, it's interesting. So I always, people always say not all of the residents have family members involved with them. But what's interesting is that, and this is again around building a community in that setting, the family members who visit often are often even interacting with those residents that they're not related to. So I think the more that it creates a welcoming atmosphere for those family members, it actually can help to enrich the lives of all residents, right?
Absolutely.
Because sometimes they will notice that a resident needs new clothes, or they might want to bring them a piece of cake, or they might want to get them a holiday gift, and they're not quite sure how to do that. And I think, also the family members have great ideas about things to do, and they're very creative. And so I think for all the residents, the potential for family members to enrich their care experience is there. So, yeah.
Yeah, very interesting. So in the field that you're working in, what are some of the challenges then when it comes to knowledge translation with family members?
Well, I think, again, in lots of healthcare settings, it is sometimes the gatekeeping that happens by administrators and staff. And so we've been really fortunate to be able to do this study and pilot it in a setting that is incredibly welcoming. Because one of the things that we do in the workshops is not just have a place for people to meet, but to provide content. And so when we ask family members, what would you like to have more information about or have some education about, oftentimes it has to do with communication with staff and administrators. So there's an impact for them when family members participate in the study. And so we've been really fortunate to work in an environment that is incredibly welcoming and is sort of expecting that family members are going to come out of this experience and maybe be having different kinds of conversations with them. So I think that is a potential challenge of being in an environment where it's not as welcoming to that changing role and presence of families. The other thing, I think, as always, funding is a big issue for researchers. So trying to find places that are interested in supporting this kind of work. So we've been fortunate to have funding from the Canadian Frailty Network and also from the Alzheimer's Society of Canada. Yeah.
And do you think that other facilities would be generally open to this sort of program?
I think there's variation in openness. I think that as we shift towards more, we call it patient-oriented research. In my world, it's like resident and family-oriented research, and patient and family engagement. I don't think there's a big choice in the matter. So I think it is really a benefit to organizations to be more open and to be looking at this as an opportunity. I mean, there's nothing scary about it. To have more active family members in your facility. But what you have to be willing to do is give up some of your power and control over the way things are. And not everybody's ready for that. So it is, looking at the successes that happen at particular sites and then having other places say, yeah, I'd be open to doing that. Because we really need that commitment from the organization to be able to get in and do this kind of research.
Well, it sounds like you've had very positive experiences with where you're working, so hopefully that can sort of act as a guide and encouragement for other facilities.
Absolutely. And we are, as one of our KT activities, going to be developing a toolkit for family members so that we don't have to rely on administrators or staff to introduce this kind of activity, but for family members to say, how do we create a group where we can get together? What kinds of things might we want to talk about? Who should be there? What could that look like? So that they can take the initiative to do that.
That's great. So they can do it on their own end without having to involve. Interesting. So the facility that you're working on right now, is it public or private?
I've worked in research across all different types of facilities. Right now, my main partnership is with what we would call here in BC an owner-operated type facility, where the health authority owns the facility where we're doing the research. But over the course of the last 10 or 15 years where I've been doing research, we've kind of gone to all different kinds of sites and all different sizes of sites.
That's great to have that diversity. Do you see there being a difference between public or private residences in terms of what you're studying and family involvement?
I think that in terms of the openness to family involvement, it depends on the corporate leadership and whether that corporate leadership is a nonprofit board or a health authority or a private company. It's really at that level that type of openness is fostered, and then how it's taken up by the individuals at the site. So I don't. So I don't think ownership has had a particular big impact. Our last study involved, so the original study that I talked about at the beginning involved an owner-operated, a nonprofit, and a private for-profit facility. We were at 3 sites, and all of them were really open and willing to participate in the research. Yeah.
That's very interesting.
Yeah.
So I know you've spoken about your presentation a bit. Is there anything else you want to touch on about the research you're doing?
I think that, in terms of challenges, one of the things that I really took away from my experience of creating the workshops with families was that everyone needs to have a shared understanding of what the goal is from the beginning. So even though I'm considered sort of the lead and I wanted to kind of step out of that, it wasn't always clear, not only to the family members, but to the other researchers and people involved, that this was a different way of doing things.
Yeah.
And I think as we're going to be doing the study again, it's really making sure that it's very clear at every step of the way how we're going to work together.
Yeah.
Because I think I kind of went in with an expectation that everyone would understand.
But I'm sure everybody
that
has
model,
their own different ideas.
But everyone comes in with their own idea,
Yeah.
absolutely. So I think having those conversations and being very frank and open about them is really an important part for teams to be able to work well together.
Yeah, absolutely. So out of curiosity, the family members that you're working with, do you work with children as well, grandchildren?
It's been interesting, and so that aspect of it, when we did this first version of the study, we had spouses, we had family by choice, we had children, and we didn't have any grandchildren in that particular study, and I think mostly because we did the workshops during the week.
Okay.
And so what we found as we move forward is it might be more appropriate, to have weekend or evening sessions.
So it's more accessible
Yes.
to it.
And we also found that for different types of family members, there are different issues. And so spouses had a particular kind of topic they wanted, and children were a different type of topic. So we learned a lot about the diversity in families, and I think sometimes, we look at families and patients as a homogenous group if they all share something in common. And the reality is, it's hugely diverse.
Yeah, absolutely.
So I think that was a big takeaway from that project in terms of working with families. And we asked people to volunteer if they wanted to be part of the development team in particular, because it did require more time. And so I think one of the things in my research is we often have a sustained engagement with a site. And so now we're going to be doing the study again at the same site. So we know family members from the group last time that we will invite to take more of a lead role this time. Yeah.
It's very interesting. Yeah, it sounds like there's so many different dimensions that have to be considered.
For sure. Yes.
So sort of thinking about what you're studying in a broader sense, in the way patients' families interact with healthcare providers and patients and all sorts of places in healthcare, what sort of advice would you give to family members that want to be a part of their family member's care?
Yeah, I think we need to develop a little bit of an authenticity test, because one of the quotes from the family members we interviewed who participated said, I didn't have much to say until I realized that I wasn't just there for tokenism, basically.
Interesting.
Yes.
That's a big issue.
It is a big issue, so I bring it up here because I think that the time and the wisdom of patients and family members is tremendous. And so in our research, we paid people honorariums, for sure, to participate. But I think also, if I was choosing to participate as a patient or family member, to be looking at the authenticity of the project. Like, how am I, am I just getting information? Is this a one-way kind of a relationship? Or am I actually having meaningful input into this project?
And are my opinions valued?
Absolutely.
Yeah, which sometimes patients don't feel like their opinions are valued.
And, I think that's another thing that came out of the research, and what we struggled with was the degree to which different types of knowledge are valued. And patients and family members come in with experiential knowledge, and oftentimes are a single case, their own experience. And what I found was that for some people in clinician and research roles, that was incredibly difficult to sit at a table and think this person's knowledge has as much right to be here as mine. And that is something I haven't really figured out yet, but I was kind of really taken aback by it because I think that is where the work needs to be done.
Interesting.
I think the patients and families have so much to offer, and whoever is sort of in that lead role on a team needs to take responsibility to go to everybody at the table and say, this, what is your issue? Or let's unpack that. Because maybe we don't need you to be here, as opposed to kind of belittling the patient and family experience. So that for me was a huge takeaway. So I think for patients and families thinking about embarking is really to be looking at the authenticity. I think it's okay to say, this is what I'd like to get out of this, and are you providing that? Because you don't want to end up at the end feeling like it was tokenism.
Yeah.
That's a horrible feeling, especially for people, who have chronic illnesses or who have a lot of other competing demands in their life, to be giving their time and expertise
and
to research. Making
being
themselves vulnerable. Absolutely. And you can imagine in our research, that was a big part of it. People are traumatized in the system. And so I think as a sort of, it's almost like what you want in any job you go to for employment. I think walking into it as a patient or family member, as much as you want to be part of that research, if it's not going to be authentic, it's probably not going to be something worthwhile.
Yeah, and I think as well, I've participated in research before, and I know it's intimidating going into this room with these experts that are very well trained. But like you said, you need to feel you have every right to be there and to say what you would like to get out of the situation. Yeah.
And I think you bring up such an important point about the space that is used for these engagements. So I think, sometimes, and also people can feel traumatized going back to a hospital or an institution where something has happened.
Of course.
So I think for researchers to think, where can we meet in the community perhaps? And sometimes as a patient or family member to even say, could we meet at the Starbucks, or there's a room in the local library? Because sometimes even having to go back into that building can be traumatizing and distressing for people. And then you walk into a boardroom.
That's a very important point. It's so true that the space you're in really contributes to your feeling and your comfort.
Sure. So thinking about, like, there's interpersonal relations and there's the context and environment in which these types of research experiences happen, and I think you need to be considering all of it as a researcher. And I think because many researchers haven't perhaps done that kind of work before, sometimes it is, unfortunately, I don't want to put more onus on patients and families, but it's helpful because it may just never have occurred to that person.
Because they don't know. That's why patients are so valuable in that
Absolutely.
environment.
And I think, I always think, so because of the broader work that I do, if a patient said, if all the meetings always happen at the hospital, and a patient one day said, well, why don't you all come to my house and sit at my dining room table? If the group said, absolutely no, we cannot do that, then you kind of have to wonder to yourself, am I actually an equal partner at this table? Because I'm not saying people should have to have everybody over to their house, but, typically, the people who are being paid, to be there as researchers or clinicians, if there are multiple sites involved, we might circulate the site where stuff happens. So I think all of those ways in which we're kind of pushing the envelope in terms of what is really going on here in this relationship is so important to kind of suss out if it's worth sharing your story.
Of course, and there's so many different aspects. You were speaking earlier about compensation.
Absolutely.
And it's interesting because that can make a huge difference then, because you think, these researchers here are being paid for their time.
Well, let me tell you,
if me being here is just as important.
Yes. And if things can only happen Monday to Friday between 8 and 4, how accessible is that experience? And so there are some guidelines now around compensation, but I certainly think that people should never have to pay for transportation costs for parking. And then there are guidelines now around an hourly rate sometimes for patient or family members, sometimes in some situations giving gift cards, but really I think when you start to monetize it, then all of a sudden there's also a shift in thinking, right? Like everyone here at this table is being paid to be here but me. So what does that actually mean?
Yeah. Yeah, it's very interesting.
Yeah. So I think those are things, if I was in a position of being asked to do something, that I would say, okay, but have you thought about these things that might be helpful for me to actually authentically engage in your group?
Yeah.
Yeah.
Yeah, well, the work you are doing is so important and is so interesting, and I feel like you really understand all of these dimensions that I sometimes feel as a patient.
Well, that makes me feel so good, because that's what I want, right? And if there are things that you think I haven't mentioned, I'd be curious to know.
No, I really feel like you that you understand the positive things and the negative things, and you're working to make those changes in the field that you're working in.
Well, I'm so happy there's people like you, Maya, who are here too, because it's really, that's how we'll push sort of forward in our research agendas, be able to spend our funding as wisely as possible on the things that are important for the people who it matters.
Exactly. Well, thank you so much for joining us today. We'll be back with our